March is National Endometriosis Awareness Month. Got a couple days left. Got to get in this one. It is certainly time to really kind of talk about this underdiagnosed condition. And joining us on the digital desk to talk more about it is Dr. Sarah Zebarth with Methodist Olive Branch. Dr. Zebarth, thank you for joining us. Let's talk about what exactly is endometriosis. Am I saying it right?
Yeah, endometriosis. Yeah, so endometriosis is a condition where the endometrium, or the lining of the inside of the uterus, actually grows places in the pelvis that it shouldn't grow. So you can see little implants of that tissue growing either on the ovaries, the fallopian tubes, or the lining of the pelvis, and it can cause a lot of problems for women. So you can get really painful periods with this. Women get lots of chronic pelvic pain, and long-term you can get fertility issues as well. So it's actually a pretty common and underdiagnosed condition, which can have a lot of long-term effects on women.
Yeah, I have heard about it, and it sounds painful. Can you talk about some of the signs and the symptoms so our viewers kind of can understand what to look for?
Yeah. So the most common complaint we get is women who have very painful menstrual cycles, and they'll come in to our office complaining of such severe pain. They're not able to do their daily activities. I have women who have gone for years, just being in their bed for a day or two out of the month, and there's just an abnormal degree of pain. Also, you can get pain with other daily activities. I have a lot of patients who have pain with intercourse, pain with urination, pain with bowel movements, and long-term, these symptoms can kind of progress and get worse. And then some women even develop kind of long-term chronic pelvic pain as well.
So why is this an underdiagnosed condition, and how does it impact fertility? I'm curious.
No, that's a great question. So we think around 6 to 10% of women have endometriosis, but it's very hard to prove because we're looking at very small microscopic implants, and sometimes only a few millimeters. So it's not easily picked up on ultrasound or any other kind of imaging that we have available. So we really rely on the clinical picture and some classic symptoms, and treat women for suspected endometriosis. But the only way to prove a diagnosis of endometriosis is actually through surgery with a biopsy, where we can take a piece of that tissue if we see it, send it off, look under the microscope, and see that it's endometrial cells.
You mentioned treatments for people with endometriosis. What kind of treatments are available, doctor?
Yeah, so endometriosis is a tissue that responds to hormone stimulation. So it's actually the hormones in your ovaries that make the endometriosis flare up and become painful. So what we often do is try to suppress the ovaries. So a lot of times we'll give women hormone therapy. Typically birth control pills can be very effective treatment at quieting down endometriosis and stopping the progression of it over time. So the mainstay therapy is hormones, and long-term surgery may be required in some patients, but not all.
Okay, and we have thousands of viewers that join us here on the Action News 5 digital desk, doctor. So if you're talking to the women out there, what would you like to tell them this morning so that they can, get a heads up, talk to their doctor if they have some of these painful symptoms?
Yeah, I would say my biggest word of advice is just speak with your physician and let them know the symptoms that you're having, and keep being an advocate for your care and get answers, and know that there are multiple treatments out there. And if you've tried something that didn't work, don't get frustrated. There are other things that we can do. A lot of this is kind of trial and error, and we go from one step to the next, but a lot of times we can find really successful treatments for women long term. The other thing that's really important is to know to get treatment early, because endometriosis does progress over time and it can lead to infertility. So in younger women, you might not know that, but I have a lot of women who come to me later on in life and by then have a lot of scarring on the fallopian tubes and things like that. And so we want to be proactive with treating that gynecologists.
Okay, so March is National Endometriosis Awareness Month. Dr. Sarah Zebarth with Methodist Olive Branch. We really appreciate you joining us, kind of explaining what it is, the symptoms, the signs, and how very important it is to talk with your doctor if you suspect you have any of these symptoms. Thanks so very much. Appreciate it.
Thank you for having me. My pleasure.